the 2017 ASCP Annual Meeting. It was all here. For 3 fantastic days, colleagues from around the globe gathered in Chicago for an unequaled experience. Practical, personalized, and innovative, with education and networking opportunities that brought their skills and knowledge to an entirely new level.
What an incredible meeting we've had this week. This was probably the largest meeting we've had in over 10 years. ASCP continues to showcase its education. We had leaders from all over the world, and everywhere we see our excellent work being done.
The halls were abuzz with attendees commenting about how excited they were by the meeting's progressive education, with many saying that the educational opportunity was unparalleled in laboratory pathology medicine.
Laboratory professionals, pathologists, residents, students, medical students, what we saw was the coming together amalgamation of a tremendous euphoria where we're going to continue to showcase this education.
I believe that ASCP's Nexpo programming is valuable for our students because we try to pair rigorous coursework in the classroom at our Math and Science Academy with applied experiences in the field. So for students to be able to come and meet with professionals and see what they do on a day-to-day basis is a way for them to anchor the things that we do in the classroom with real-life experiences. For a lot of students, coming to an event like this could be the key that unlocks for them a completely different way of thinking about their future, a completely different way of how they conceptualize their path forward, and it could be life-changing for kids.
But we also had a great opportunity to showcase our global footprint, and we brought in Ambassador Deborah Birx, who is a U.S. Ambassador to the United Nations on HIV/AIDS. She's been working with us on PEPFAR, which is the President's Emergency Relief Act for AIDS, over the past 10 some odd years. And Dr. Birx has said that ASCP is in fact the go-to organization for the world to bring that global exposure, both on communicable diseases such as HIV/AIDS, but now as we move into the non-communicable space and helping prevent and diagnose cancer across sub-Saharan Africa. Dr. Birx spent her time discussing during one of the plenary sessions the ability to showcase how a global footprint is protective of all healthcare, and it's our fiduciary responsibility, our ethical responsibility, to make sure that we bring changes and we bring testing to those patients who do not have access currently in the world. In addition to what Dr. Birx discussed, we had a phenomenal plenary session the following day on advanced analytics, and 2 gentlemen, one which was the director of the Ohio State University James Cancer Center. His name is Michael Caligiuri. Dr. Caligiuri actually is also the president of the American Association of Cancer Research. And they discussed why we as a profession need to be in the middle of the data harnessing space. That is, working together in a collaborative fashion. He discussed Orion. Orion is a network of organizations across the United States and the world where we will cobble together our data to inform better diagnostic acuity. He was followed by a gentleman from the University of Washington, Colin Pritchard, who also discussed the right test at the right time, at the right diagnosis, and that is, of course, advanced analytics. In the past, we used to refer to this as personalized medicine, but what we're really referring to is using technology in order to harness bigger, better data in order to improve the patient care formula. But more importantly, how, again, the laboratory has got to be a crucial apex for making sure that we, in fact, do bring better changes and better personalized care to our patients across the world.
For pathologists, laboratory professionals, and residents, there was something for everyone at the meeting. Laboratory medicine is the centerpiece of diagnostic medicine, and that was showcased this year.
I think one thing that's also very interesting about the evolution of the ASCP Annual Meeting is just to see the incredible exposure that we're seeing to residents. The number of physician residents who came to the meeting this year is the largest it's ever been. They're the legacy for our profession, and they brought what's necessary to this meeting to show that they're going to be our future practitioners, and we're going to rely on them to help us push the needle forward.
Education, networking, excitement. It was all there at the 2017 Annual Meeting, and that spectacular positive energy will continue to grow and energize the ASCP 2018 Annual Meeting in Baltimore, Maryland. Come join us.